Hey, Jim Hoffman here for EMS Office Hours. This is your Monday Minutes. Okay, we're going to pick up again, do some more EMS quick study tips in this episode, and this is episode 12. It's actually 12A because this one is going to talk about circulatory system in the heart. And, like I mentioned in previous videos, this is important because this is going to be key concepts and elements that's going to help you greatly when you're taking your exams. And I also feel it's going to really help you when it comes to things like your patient assessment, your clinical impression, your treatments and transport decisions, and with your documentation. So it's not just a quick 5-6 minute video of me just kind of hitting on high points, which is important, but it's also great for you that if I say something or mention a key element in these videos and you don't understand it, or you need to look up more because it's not ringing a bell for you, it's not directing you to right answers or a greater understanding, then to go ahead and crack open that textbook and look it up. All right, do some research, do a little self-learning. Okay, you'll find that by doing that, watch it. Let's say you watch one of these videos and there's something you don't quite get. Study up on it for 20, 30 minutes. Okay, not every day. We have to live lives, right? But once a week maybe, and you will find your knowledge base steadily growing, and that's going to help you. And it's important because it's going to help you with your exam prep, your patient care, documentation, and all that. All right, so let's get on with this, guys. I know your time is important, and I know that you are here for these key elements. And like I mentioned, this is kind of part one. We're talking about the heart and the circulatory system. And we talk about the heart, and it's the heart, the blood, and the blood vessels, right? The heart weighs about 8 to 12 ounces. Again, this is something that might be disputed depending upon what textbook you're looking at, who you're asking, okay? But in general, 8 to 12 ounces, okay? And the heart's a muscle, right? And it's called the myocardium. Most of us already know this. Again, guys, high points, key elements, okay? Often you will see a question that'll ask you what the myocardium is. Is it a muscle? Is it a tissue? Is it an organ? Okay? This is what I'm trying to hit home for you guys. So, of course, the circulatory system, it's self-contained. It's specialized. It does one thing. It gets the blood going around the heart, okay? So what I want to go over here real quick is to talk about how the blood moves around, all right? Because this here is going to be something you probably will see on exams, okay? As far as where the blood goes, how it gets pushed out to the body, all right? So I was going to show you an image of the heart and all that, but I've got videos on EMS Office Hours on that, showing the heart pumping through and all. So I don't want to just show you another video I already did, but I want to just kind of go over step by step here, okay, how the blood moves around. So first, you get that deoxygenated blood. It's coming into the heart from the superior and inferior vena cava, okay? Then it goes into your right atrium, okay, through the tricuspid valve, into the right ventricle, and that semilunar valve to the pulmonary arteries, out to the lungs, where it's going to get transferred, right? You're going to get the dirty blood to the clean blood, the deoxygenated blood to the oxygenated blood, okay? So that oxygenated blood now is going to come back. It's coming back through via the pulmonary veins, okay? Now, this is something that I sort of use as just as kind of sidebar here, that I use to help me remember pulmonary veins and pulmonary arteries, where in the body the veins carry that deoxygenated blood, and the arteries have the oxygenated blood. When it comes to the heart and the lungs, and you talk about the pulmonary arteries and pulmonary veins, it's reversed. Okay, that's how I kind of remember that, and it helps me remember those key points. Okay, all right. So up to 4 here. The oxygen in the blood is coming back, and it's coming back via the pulmonary veins. All right. Then it goes into the left atrium via the bicuspid valve into the left ventricle. And from there, it goes through the semilunar valve again, out to the body via the aorta. All right? So this is a flow of blood in the heart, where it's going and what's sort of happening, okay? Because you're going to see questions as far as what valves separate left atrium, left ventricle. What valves separate right atrium, right ventricle. Okay, so you want to know the tricuspid, bicuspid. You're going to want to know where the oxygenated blood is coming from, superior, inferior vena cava. These are those key elements that you're going to want to remember. Okay, and a lot of times you will see questions that are going to tell you, ask you, how does the blood flow through the heart and the veins and exchange oxygen. And this here is your key concepts, the key elements to answer that question. If you don't understand this and you need pictures, go to emsofficehours.com, look for the videos that I have there on this, or open up your textbook, look for those graphics, or even go to YouTube. You can get graphics, okay, showing you how this all works, or if you don't understand it, all right? Get a good understanding of this, guy, because this is the type of stuff you're going to see a lot on exams. And it's going to help you as well when you're thinking about things that are going on with your patient. When we talk about CHF and right heart failure versus left heart failure, how this is all working, okay? All right. The cardiac cycle, your systolic blood pressure. This is that pressure in the arteries as the left ventricle contracts. Guys, this is really the meat and potatoes here, okay? Your diastolic pressure. This is that relaxation phase. This is the pressure in the arteries at rest. You are going to see this on a test, okay? Maybe not the next test you take, maybe not the one after, but eventually you will see a question that asks you, what is this? The systolic blood pressure represents what? Okay, and one of the answers are going to be pressure when the left ventricle contracts, or it's going to say something like, one of the answer choices might be represents ventricular contraction. Okay, this is the type of stuff you're going to see, guys. All right, what is systolic? What's happening in systolic pressure and what's happening in diastolic pressure? You're going to see this type of question, all right, in one form or another. That's why knowing the key element, the broader answer here, is going to help ring those bells for you when you see that question pop up on a test, okay? All right, now I have some numbers here. These are general. I pulled these out of a textbook just to kind of give a popular answer, but normal blood pressure, systolic-wise, is usually between 100 and 140. Some people start freaking out if a patient has a systolic blood pressure of 142. They start thinking they're hypertensive, and they start screaming and want to race the patient to the hospital. Okay, but for our purposes here, and again, depending upon who you're speaking to and what textbook you look at, all right, the numbers might vary a little bit. But normal systolic blood pressure between 100 and 140, and normal diastolic BP is between 50 and 90. Okay, general numbers, just to give you an idea what you're looking at when it comes normal. All right, you might have heard different numbers, you might have seen different numbers. You might not consider a person with 150 systolic BP to be hypertensive. Other people might. Okay, of course, you're looking at your entire patient presentation, patient history, medications, all that stuff ties in together. That's why I'm always encouraging you guys to increase your knowledge base, keep going, using the resources on EMS Office Hours, on my other website, EMS SEO, or even as a premium member over at turbomedic.com. all designed to keep building that knowledge base. Okay, may not have all the answers personally, but the answers are on those websites. And if you can't find them, you let me know. I'll get you that answer. All right, guys. That's going to be it for this part 1 or 12A. Okay. Next time we're going to finish up on the heart and circulatory system, and we're going to talk about the electrical system itself, cardiac volume, and regulation and heart function. Okay, so we'll pick up on that next time. Again, if you ever have any questions or comments or concerns about what we're talking about here on the Monday Minutes, let me know. Let me know if you want to see an episode on a particular topic. I'll be sure to try to design one and get one up there for you. My email is contact@emsofficehours.com. I hope you enjoy these Monday Minutes. If you have, again, any questions or whatever, be sure to send them over to me. I'd love to see your comments too right here on the blog, and the show notes would be great. Or just send me an email, and I will converse with you privately. All right, guys, that's it for me. One last quick thing. If you enjoy these, I know I mentioned this on a lot of the Monday Minutes, and I kind of push this out, not because I'm trying to get rich selling this very inexpensive digital download here. Pretty much it covers my bandwidth, but I offer this out, guys, because this is really a compilation of everything here on these quick study tips videos. Okay, it really condenses your really thick textbook or 2, 3, 4 textbooks into about 100 or so pages. Okay, it's not something you should use to be the complete study resource, but a perfect guide to review before an exam. All right. Go check this out. I'm telling you, this will be something you can add to your EMS library. Have it on your computer. Look at it on your Kindle. Okay, and you'll turn to this whenever you want to look something up real quick. You're not quite sure about something, and hopefully will, of course, guide you to some further investigation and broader learning via textbook or videos or online stuff or through the websites that I've mentioned earlier. All right, guys. That's it for me. Again, questions, comments, concerns, suggestions, you hate me, you love me, whatever the case may be, I want to hear it. I love talking to the membership, but trust me when I tell you that. All right? My email is contact@emsofficehours.com. Until next week, as always, this is Jim Hoffman for the Monday Minute EMS Office Hours. Stay safe.